Hi guys, welcome to my YouTube channel. I'm Purwa. So in this session, I would like to give some information about the medical instruments which will be used by the hospital staff in the hospital or clinic. So let me share to you. Yeah, here it is. So what is the objective of our discussion today? The first one is to describe the functions of medical instruments, and then the second one is to pronounce name of medical instruments. Well, as the information, the medical instruments can be divided into three. The first one is wound dressing tool, the second one patient care equipment, and then the last one tools to diagnose disease. So let me start to give you information about the medical instruments one by one. The first we start from stethoscope. Stethoscope is a medical instrument which is used to listen low volume sounds such as heartbeat. And now we have syringe. Syringe is a medical device which is used to inject fluid into or withdraw fluid from the body. And then we have stretcher. Stretcher is used for carrying sick, injured, or dead people. And then we have curette. Curette is a small surgical instrument which is used to clean the wound of the abortion patient. And then we have tourniquet. Tourniquet is a tightly compressed bandage used to stop the bleeding by stopping the flow of the blood through a large artery in lung. And then we have pipette. Pipette is a small glass tube used for transferring or delivering measured quantities of liquid from one place to another. Well, now we continue our discussion with gag. What is gag? Gag is a device for keeping the patient's mouth open during a dental or surgical operation. And then we have sling. Sling is a band of material looped around an object, example, a broken arm to support or leave it. And then we have thermometer. It's an instrument which is used to measuring the body's temperature. We have scalpel. Scalpel is a small and extremely sharp bladed instrument used for surgery. And then we have dressing trolley. Dressing trolley is used for carrying things and put medical equipment for patients. And then we have catheter. Catheter is commonly used when the people hurt in their urinary process. Well, now we continue again about gauze bandage. Gauze bandage is a thin woven fabric that is placed over a wound to keep it clean so air can penetrate and improve the healing. And then we also have elastic bandage, commonly used to treat muscle sprains and strains by reducing the flow of blood to a particular area and can restrict swelling at the place of injury. And then we also have neck bandage. Neck bandage used to prop up the head and restrict the movements of the cervical spine. Then we have Theis bandage. Theis bandage comes from the gauze, which is wrapped calcium absorbed in warm water in order to harden for patients with fracture. And then next we have sling. Sling is a band of material looped around an object to support or lift the broken arm. And then we also have forceps. Forceps is a medical instrument which is used for holding something. And then we have splint. Splint commonly used to immobilize a fracture or dislocated bones or to maintain any part of the body in a fixed position. Okay, next we have Lister's bandage scissors. Lister's bandage scissors used for help in cutting bandage without touching the skin. And then we also have immerses dosage. Immerses dosage used for putting sterile medical instruments. And then we have bowl. Bowl, or commonly called as the galley pot, also used to hold medicine, to put liquid or gel, used when take and sterile implementation. And then we have Cheeto forceps. Cheeto forceps is used to handle the sterile instrument. And then we have Celia forceps, or plain dissecting forceps, used to handle the tissues and other materials, and also to manipulate needles and other instruments while operating. And now we have suture scissors. Suture scissors, tool for cutting paper, tools for cutting the body and then joining together in the middle, and sewing up the wound, especially after an operation. And then we have also Markle clips. Markle clips used for holding things together. And then we have receiver or kidney disc. Receiver and kidney disc used to push waste such as bandage, wipes, and etc. And also we have wheelchair. A chair wheel for somebody who is unable to walk. And now we have crutches. Crutch is often used for people who cannot use their leg to support their weight, or for recovering from short-term injuries to lifelong disabilities. And then we also have lithotripsy sinus forceps. Lithotripsy sinus forceps are used when fingers are too large to grasp small objects in the nose. And then we have trapeze. Trapeze to help the patient change the position while they are in the bed, or to aid in transferring from bed to the chair with easy attendant assistance. And then we have glass mercury thermometer used to check the temperature. And the next one, we have chemical Doyle thermometer, also used to check the temperature by color changes in chemicals that bonding to a plastic tray. And then we also have digital thermometer, also used for measuring the temperatures of our body. And then we have infrared thermometers, commonly used as a sensor for reading the changes cellular things when we are not possible to be in physical contact with the object being measured. And then we also have mercury sphygmomanometer to check the blood pressure of the body. We also have aneroid manometer or aneroid sphygmomanometer and electrical sphygmomanometer. And then the next one, we have Snellen alphabet chart. Is an eye chart used by eye care professional and other to measure visual acuity. And then we have scale. Scale used to measuring the weight of somebody or the patient. And also we have the wound probe. Wound probe used to clean the wound. And we have walker to help for walking. Example, for the elderly people who have something wrong with their leg. And then we have rail. Rail here help to encourage baby to walk. And then we have cane, used to support for a walking stick. And then we have antiseptic, is a substance preventing disease by destroying the bacteria. And then we have elastic tape. Elastic tape used in an attempt to treat acute injuries and a variety of other physical disorders. Well, intravenous bag or IV bag is a bag used to store sterile intravenous fluid such as infusion, NaCl, RL, and others. And then medicine cup. Medicine cup is the plate or small container shaped like a bowl that is used to measure the medicine that will be consumed, especially for liquid. And then we have oxygen mask is used for transferring breathing oxygen gas. Device may cover the nose and mouth that supplies oxygen from attached storage. And then we have test tube is a thin glass tube used to hold small amounts of material for laboratory testing or experiments. And then we have vial. Vial is a small glass or plastic vessel or bottle, often used to store medication as liquids, powders, or capsule. And then we also have the bed rail. It's a rail along the side of bed, connecting the headboard to the footboard for the safety of the patient. Therefore, they will not fall down while sleeping. And then we continue, we have microscope. So microscope is used for observing small objects appear larger. And then we have phantom. Phantom is a mass of material similar to human tissue. And then privacy screen is used to maintain the privacy of the patient, to provide comfort to the patient. We have mortar and pestle to destroy the drug and chemical solids mixing. And we have hot water bottle used to compress when you have fever and commonly used with warm water. And then we have ice bag. Ice bag to compress when you have fever and commonly used with the cold water. And then we also have breast pump. Breast pump used to pump the milk out of the breast for the breastfeeding woman. And then we have nipple shield. Nipple shield is used to protect the sore nipples during the breastfeeding. And also we have the air cushion as a sit-in patient with hemorrhage. And we have the colostomy bag as a vessel patch before the operation. And then we have urinal used for male, and also this one used for female. The function is to help the patient who cannot go to the toilet for the urinal. And then bedpan used for the patient who cannot pop or go to the toilet for pop. And then hand gloves to protect the hygiene of the hands. And then we have urine bag to hold urine associated with the balloon catheter. And then we have the stomach tube. Stomach tube are like stomach tube used to collect the liquid for rinsing and washing the stomach contents and for the distribution of the drugs. And then we have feeding tube used for the nutrition of food fluids through the mouth or nose. Now we have the wing needle, especially for the children. That is for the intravenous fluids or intravenous drugs in the long term. And then we have infusion set for giving an infusion. And then we have transfusion set to give transfusion. And then we have the injection needle to help us for giving the injection. And we have the glycerin syringe to get some fluids to anus. And then color blindness test booth used to check the color for the blind. And then reflex hammer is to mind the ability of the reflection of certain parts of our body, such as knee. And then we also have tongue blade. Tongue blade is used to check or see the abnormalities in throat, such as tonsil, pharyngitis, and etc. And we have laryngeal mirror. Laryngeal mirror used to check the abnormalities in throat, such as tonsil and pharyngitis. And also we have the obstetrical stethoscope or stethoscope monaural to hear the baby's heart in the lungs of the pregnant woman. And also we have the heart rate monitor to tell us how fast our heart is beating. And we have infant incubator. Is designed to provide a safe and controlled space for infants to live while their vital organs develop. And then we have baby snatch is a bed specifically used for babies from birth to about 4 months. And also we have baby bed, contains a child capable of standing here to protect the baby. And then we have the baby scale used to weigh the newborn baby in order to maintain and ensure that the weight things are within normal. And then we have the baby belt maternity to help the pregnant woman avoid injury or to gently cradle your bump or stabilize the body. And then we have baby fetal Doppler. Use sound waves to check your baby's heartbeat. And then we have baby compressor nebulator, are useful in treating certain respiratory conditions. And then we have fetal heart listener detector to detect fetal heart activity, which may be during late pregnancy and labor. And we have the face mask. It is considered as the first step to prevent the spread of the disease, covering your mouth and nose, which are primarily used to prevent transmissions by holding the backdrop lunch. And then baby asthma inhaler used to keep them well with their asthma over time by preventing inflammation in their airways. And then we have infant backpack to help with baby batch. And then identification bracelet or ID bracelet is a piece of jewelry that you wear around your wrist to inform emergency health worker about any condition you may have or other concern that may be relevant to your care. And then we have nasal speculum to examine the nasal cavity. And then we have ear speculum to examine the ear cavity. And next we have the rectum speculum. The rectum speculum used to examine the anal canal of rectal cavity. And then we have the vaginal speculum used to examine the vaginal opening. And then we have the artery forceps to clamp the arteries. And we have the surgical needles or suture needles used for the surgery in the operating theater. And then we have the bandit scissor, cut the verbands or glues, and then dissecting scissor is used to cut the body tissue for practical purposes. And then we have surgical forceps or tissue forceps for the operating staff. The characteristic is the ends of the visage are both tight, and then the peritoneum forceps to cleanse the lining of the stomach. And then we have the needle holder for clamping sewing needles for the hepatic and sewing open wounds such as accident or surgery wounds.